Welcome, ladies and gentlemen, to another episode of Women's Health Today with Dr. C. I am Dr. Leroy Campbell, also known as Dr. C, the Women's Health Doc. Today, we're going to be talking about another very important topic in women's health. We're going to be talking about polycystic ovary syndrome. Polycystic ovary syndrome, often referred to in short as PCOS. We're going to be talking about PCOS. And we're going to answer four questions today. And the four questions we're going to be answering are one, what is polycystic ovary syndrome? Two, why is polycystic ovary syndrome important for us to talk about and to be aware of? Three, we're going to explain the cause of polycystic ovary syndrome. Four, we're going to talk about how polycystic ovary syndrome affects the body and why it causes the problems that it causes. So it's going to be a very productive video. Make sure that you stay tuned. If you're new to the channel, all our content here is designed around empowering women through quality health education. When women are able to take care of their health and understand their health, they're able to live healthier, happier, and more fulfilling lives. So, of course, if this is also important to you, then make sure that you smash that like button, share this video, and subscribe so that together we can continue to enhance the quality of life of our women. All right, great. Let's get to it. I think it's best for us to start by looking at why polycystic syndrome is important. All right, why is this condition so important? First of all, polycystic ovary syndrome affects about 10% of women of reproductive age. WHO puts the range between 8 to 13%, depending on which country you're living in. The majority of women who are affected by polycystic ovary syndrome do not know that they have the disease. It's estimated that 70% of women remain undiagnosed worldwide. Most of the time, when we're dealing with issues related to lack of ovulation, irregular periods, and infertility, PCOS is the cause. It is the single most common cause of anovulation, and it is a leading cause of infertility. Also, it's important to understand that PCOS is associated with a number of long-term health problems. And this is where I think the clincher is. This is where I think the most important aspect of this disease is not just the issues from a menstrual or gynecological standpoint, but what are going to be the effects long-term on physical and emotional health. And that is what I'm going to try to help you to grasp and to understand today. Now, it can be argued that polycystic ovary syndrome is the biggest killer of women in the history of mankind. Let's put this in perspective. Women who polycystic ovary syndrome are at significantly increased risk of a number of very serious complications, including diabetes, hyperlipidemia or high cholesterol, hypertension, which in turn puts them at risk of cardiovascular disease, cancer, depression, and anxiety, as well as suicide. The woman who is not diagnosed with polycystic ovary syndrome at 24 and is not appropriately managed at 24 is going to present later on at 50 years old to the endocrinologist with diabetes, going to present to the cardiologist with heart disease, is going to be at risk of renal disease, is going to be at increased risk of cancer. Cardiovascular disease accounts for 1/3 of the deaths in women globally. It is the leading cause of death in women globally. Cancer is another major cause of death. Depression, anxiety. Do you know that women with polycystic ovary syndrome are 10 times more likely to attempt suicide than other women who do not have polycystic ovary syndrome? PCOS is associated with a 10 times increased risk of suicide compared to women who do not have PCOS. That's putting it in perspective. This is a condition that we need to be talking about and focusing on because women are dying and they don't know why. 5 of the top 10 leading causes of death in women can be linked directly to polycystic ovary syndrome. All right. I hope that did it for you to understand why it's so important for us to talk about it. Today, we're going to start that process of educating our women and making sure that they are able to deal with this very serious issue of PCOS. Let's talk a little bit about what PCOS is, and then we'll go into getting you to understand a little bit about the physiology, how it affects the body, and why it leads to different problems. When we talk about polycystic ovary syndrome or PCOS, I'm going to use PCOS going forward because it's easier. So what is PCOS? This is the definition I'm going to use. And I want you to pay close attention because this is not a definition that you're going to see everywhere. This is, but it's very important because it's comprehensive. Okay, so what is PCOS? There are 3 things that I think are important in defining PCOS. PCOS is a multisystemic metabolic disorder that arises consequent to insulin resistance and hyperinsulinemia. All right. Now that sounds quite sciencey. So I'm going to break it down for you. The first thing is for us to understand that while we talk about PCOS, polycystic ovary syndrome, as if it's just a gynecological problem causing multiple cysts in the ovaries, that's how it got its name, because a long time ago, when we were just beginning to understand about the disease, one of the features that was commonly seen was that on ultrasound, the ovaries had multiple cysts. And I'm going to explain to you why ovaries would have multiple cysts in the case of PCOS. That's the reason why the term polycystic ovary syndrome was coined. Polycystic ovary syndrome is more than just a gynecological problem that causes irregular periods and infertility. It's actually multisystemic, meaning it affects almost every system in the body. Every organ in the body can potentially be affected by polycystic ovary syndrome. The second thing is that it's a metabolic disorder, meaning it affects the body's processes, okay? How the body functions, how it carries out its day-to-day function, right? So if you think about it, then that explains to you why its effects is so pervasive, why it's affecting all the systems of the body, because metabolism and energy generation and the whole process by which chemicals interact within our bodies is occurring everywhere. The third component of the definition is the key because it tells us where the problem starts. And the problem typically is because of high levels of a hormone called insulin. And most of you would have heard of insulin in the context of diabetes, because insulin is the hormone that helps move sugar from the bloodstream into our cells. And so you would be aware of insulin, for example, being used to treat persons who have uncontrolled diabetes in some cases. Now, I use the term insulin resistance because quite often the reason for high levels of insulin is simply because the person has developed a condition in which they're not responding well to their own insulin, and as a result, the body is producing more insulin. That process by which the body does not respond as well to insulin is called insulin resistance. All right? So that, in a nutshell, is the definition of PCOS. It's a multisystemic metabolic disorder that arises consequent to insulin resistance and hyperinsulinemia. All right, wonderful. So let's begin to talk a little bit now about the causes of PCOS. We're going to talk about how it affects the body and why it can lead to so many different conditions mentioned before. A picture is worth 1,000 words. So let's take a look here. The key thing here is that there is an interaction taking place between the varying organs within the body. And it starts out really with, in most cases, with our nutrition. It starts out usually with what we eat. The underlying problem is multifactorial. There is a genetic component, and there is also a environmental component. All right. So let's, if we're going to be honest, we understand that it's both genetic as well as environmental. From the genetic standpoint, we're talking about persons who, for whatever reason, likely these are persons who typically, and we see this in PCOS often, who have a family history of diabetes, for example, family history of obesity. They have a predisposition to insulin resistance. And then when we talk about environmental, what we're talking about are eating habits. And most commonly, we're talking about a high carbohydrate diet. That's usually the main factor that triggers the initial process that leads to polycystic ovary syndrome. So we're dealing with a multifactorial problem, the genetic aspect, where we're seeing higher rates of insulin resistance and compounded by a high carbohydrate diet. It's one of the main issues why we're seeing an increase in rates of polycystic ovary syndrome worldwide. We are consuming more carbohydrates than ever in history. The evidence shows we are consuming more glucose, more sugars than ever before. In fact, what most persons are consuming within the space of a week in terms of sugar is probably more than the average person would have consumed in terms of sugar for the entire year 100 years ago. That is how much we have increased our intake of carbohydrates. And why carbohydrates are so important here is because carbohydrates are the primary nutritional ingredient that triggers the release of insulin. When we eat carbohydrates, we end up with surges in our blood sugar. This is interpreted by our pancreas, this organ here, and the pancreas secretes insulin. Okay? So high carbohydrates, right? A high carbohydrate diet is going to lead to increased secretion of insulin from the pancreas. Over time, this leads to hyperinsulinemia, which means high levels of insulin. Now, what happens is that high levels of insulin has, and I'm going to deal with, first of all, why polycystic ovary syndrome ends up coming to the gynecologist first. All right, we're going to deal with that. Because when there are high levels of insulin, there are some women whose ovaries are very sensitive to high levels of insulin. The primary function of insulin is to move glucose into our cells. Because high levels of glucose is toxic to our body, it converts glucose into the cells where it is stored as fat. Fat is a more stable way of storing energy than glucose. Glucose has to be used quickly, or else it actually begins to bind to our cells. It's almost like the effect of crystallization. When you leave something outside, after a while, if you leave a piece of rubber outside, it becomes crystallized. The same thing happens if we have high glucose in our cells. It binds to our cell surface and actually causes what we call glycosylation. That's the medical term, right? Glycosylation. Now, so insulin moves glucose into the cells to store as fat, but excess levels of insulin can have effects in other parts of the body, because we must understand that there are insulin receptors all over, not just in the fat cells, etc. There are insulin receptors on our muscles, there are insulin receptors on our liver, there are insulin receptors in our brain, there are insulin receptors on our ovaries. Okay. Well, I don't have ovaries, but in women's ovaries, all right? But there are insulin receptors on our testicles as men, all right? And, we're going to talk about this and realize later that the same thing happens to men. It just manifests a different way. But let's focus on women today because I'm the women's health doc. So we're going to be talking about women today. Another time we'll talk about men. All right. So insulin begins to bind to receptors on the ovaries. It disrupts the normal process by which the ovaries develop eggs and follicles. Every month you go through a cycle where an egg develops, and when it gets to maturity, that follicle that contains the egg ruptures and the egg comes out. That's ovulation. So we're seeing ovulation. This is an example of what ovulation looks like here. You can see the egg going through its process of developing, gets to maturation. This is the egg here. It ruptures and you ovulate, leaves a little cyst here. All right. And usually after that, the remnants of this little cyst forms what we call a corpus luteum. And this corpus luteum, let's get rid of some of this stuff that I'd written here before. And this corpus luteum actually produces a hormone called progesterone, which maintains the lining of the womb in preparation for pregnancy. And then if a woman doesn't get pregnant, that lining sheds. So usually about 14 days from the start of the menses, you'll get ovulation. And during that time, the lining of the womb grows. And after ovulation, for another 14 days, the lining of the womb remains due to the progesterone that's being produced by the corpus luteum. Now, what happens quite often is that in the case of polycystic ovary syndrome, you're going to have high insulin levels, hyperinsulinemia, and that high insulin level is going to stimulate receptors on the surface of the ovary. And when it stimulates receptors on the surface of the ovary, it disrupts this whole process, and the follicles get trapped in an early developmental phase, what we call antral phase. During this phase of development, two things happen. All right, this is important for two reasons. One is that when the follicles get trapped in this phase of development, they do not progress to ovulation. This is the reason why women with polycystic ovary syndrome have polycystic ovaries, because you end up having lots of these little follicles that have not gone to ovulation, because usually ovulation, it pops, the egg goes out, and after a while, the follicle breaks down and disappears. But in polycystic ovary syndrome, because there's no ovulation, these cysts get trapped in the ovaries. Consequently, the ovary has cysts all around the periphery. This is why the name polycystic ovary syndrome was coined in the first. Now, let's get back to the second effect. The second reason why it's important to know there is no ovulation. The follicles get trapped in this antral phase, and there is a disruption in how the hormones are produced. And so what actually happens here is that normally you would have estrogen being produced in fairly high levels, then you have ovulation and progesterone being produced. But that doesn't happen in the case of polycystic ovary syndrome. Hyperinsulinemia actually leads to two things. One is that you get increased production of testosterone and continuous production of estrogen. So the hormonal production by the ovary is disrupted. This is interesting because it's an interplay between not just the ovaries, but the brain. This whole process feeds back to the brain, and the pituitary gland, which is the gland that stimulates the ovaries in the first place, actually produces hormones in such a way as to stimulate the ovaries to produce more testosterone and continuous secretion of estrogen. This leads to two interesting things, right? Which I'm going to point out. The first thing is that high testosterone levels leads to effects such as hair growth or male pattern hair growth. The medical term for this is hirsutism. Women with PCOS may oftentimes have facial hair. So they'll grow hair in places that they really shouldn't. The mustache area, the beard, they'll grow a beard. They may have hair, sometimes even on the chest. All right. And then they may lose hair. So they grow hair in places they shouldn't and lose hair in places they should. They have male pattern, balding, etc. That's because of the effect of testosterone. The other thing that happens because of testosterone is that women also end up with oily skin and acne. So their skin changes as well. Many women have PCOS who have acne are actually women who have PCOS, but the diagnosis has not been made. All right. So that's because of the increased testosterone. The disruption in the hormones that the ovaries are producing actually affects the menstrual cycle. Now, under normal circumstances, I'm going to explain what happens with the menstrual cycle is that whenever the ovaries go through the normal process, as I explained, there is development of the lining of the uterus, the endometrium begins to grow, right? And the growth of the endometrium leads to, is in preparation, all right? So we see, so as a woman goes through a menstrual cycle and the follicles are developing, the lining of the womb starts to grow. And this growth of the lining of the uterus is primarily for the purpose of receiving an egg. This egg, once it's fertilized, okay? So about 14, so the average menstrual cycle is about 28 days. About 14 days after the woman menstruates, ovulation occurs. And in that 14-day period, you have the lining of the womb growing. After ovulation, if the egg is picked up by the fallopian tubes and it begins to move through and it's fertilized by sperm, then it has a nice, healthy, comfy endometrial lining to rest and to develop in. All right. So that's the whole point. So the whole point of ovulation and the whole point of development of the lining of the womb is to facilitate pregnancy. So after ovulation, the lining of the womb is maintained by the corpus luteum, we mentioned, for about 14 days. But if the woman doesn't get pregnant after 14 days, this lining starts to shed. And this is what comes out as the period. So when a woman sees her period, it's actually shedding of this lining of the uterus that's coming down as the period. Okay? Very important to understand. All right. So in the case of PCOS, the whole process of development of eggs, remember we said, is disrupted. All right. And so consequently, the eggs do not ovulate. You don't go through this whole process. And so what ends up happening, you get constant production of estrogen. The lining of the uterus continues to grow in a very haphazard manner. This haphazard growth is the reason why many women with PCOS may not see a period for a while, because there's no regular shedding. All right, so there's no period. And then when they do, then what happens after a while is that you just have pieces of this haphazard growth beginning to break off. And then so they'll have irregular bleeding. So at times you may see a little bleeding here, it stops, and then you may see a little bleeding there, it stops, but there's no regularity to the cycle because the ovary is not going through its usual ovarian cycle, and there's no ovulation. So this is the reason for absent periods, irregular periods in women who have polycystic ovary syndrome. And sometimes when it gets too thick, it just starts to break off, and you can have prolonged or even heavy bleeding within women who have polycystic ovary syndrome. Now you understand why that menstrual pattern is disrupted. All of this is important because, firstly, we understand now why it is that women with polycystic ovary syndrome have irregular periods. We understand now why sometimes they may have irregular spotting. We understand now why sometimes they may have heavy and unpredictable bleeding. Also important is the long-term effect. Because long-term, women with PCOS can develop problems in the lining of the womb. Because if it's growing uncontrollably over time, it can lead to cancerous or precancerous changes. So it can lead to precancer or cancer of the lining of the womb called the endometrium. Women with PCOS are at increased risk of having precancer, which we sometimes refer to as hyperplasia, as well as cancer of the womb. They also can develop polyps, which are fleshy outgrowths from the lining of the womb. These can be cancerous or non-cancerous. Many times when women present with abnormal bleeding, when we investigate, we actually find that they're actually having polyps, all right, developing in the lining of the womb. So I hope you're following me so far. So we understand now why the menstrual issues are occurring. This information that I've just taught you also explains why women with PCOS also have infertility or fertility issues. I'm careful when I say infertility because quite often I've heard patients say that physicians have told them that because they have PCOS, they can't have children. I prefer to use the term subfertility simply because having PCOS doesn't mean you can't have children. It just means that it's going to be more difficult to get pregnant. All right? It makes sense because if you remember what I told you before, the ovaries are not releasing eggs every month. So sometimes women with PCOS may not ovulate at all, or they may actually ovulate very few times. They ovulate in a very irregular pattern. Sometimes they will, sometimes they won't. So if you think about it, under normal circumstances, a woman who is ovulating has a regular cycle. You know, if she's having a regular cycle, she has a monthly period, then it means that she's going to be ovulating 12 times per year, right? So that's 12 chances for her to get pregnant. If a woman has PCOS and she's only ovulating 1 to 3 times per year, then her chances of getting pregnant would be significantly lower. So it's not that women with PCOS can't get pregnant naturally. It's just that their chances of conceiving naturally are going to be lower than the average woman, okay? Very important to understand. All right, wonderful. So now we understand the menstrual issues from a gynecological standpoint. But as I told you before, this is a multi-systemic disorder. It's not just a gynecological disorder. It's very important for us to understand this. Because once we understand this, then we will see that this is a disease that we really need to be paying attention to. So let's look at the effects of PCOS elsewhere. So let's go back to our insulin. So high insulin levels can have effects elsewhere in the body. Insulin is also what we call a growth hormone. And the reason is because there is a specific growth hormone called insulin-like growth factor, which has a similar structure to insulin. So insulin can actually stimulate growth factor receptors. It promotes the growth of tissues throughout the body, muscular tissue, fat cells. Consequently, persons with high insulin levels or hyperinsulinemia leads to growth, proliferation, right? And because it can affect any cells, if we have cancer cells, right? And you know, cancer cells are really oftentimes just cells that didn't go, you know, there is a problem in terms of how they're dividing as the body is growing. We always have cells that have the potential to become cancer cells, but our immune system removes them before they begin to proliferate. But if we have high levels of insulin, then this can also stimulate these cells, and therefore don't be surprised that apart from just uterine cancer, PCOS is associated with an increased risk of cancer overall. We add to that the fact that there are high circulating levels of estrogen, which in and of itself poses a risk. Let's press on because there's so much for us to look at here. Let's talk a little bit about the metabolic aspects, the metabolic effects. High insulin levels will be associated with obesity because, as I told you before, one of the main functions of insulin is that it binds to receptors on the fat cells and causes those cells to absorb glucose, which is converted into fat for storage. But over time, when our fat cells begin to fill up, we begin to have storage of fat in places that we typically don't have them. So we begin to have storage of fat in the muscles, in the liver, and around our organs. When we have storage of fat in the liver, we call this fatty liver. We call storage of fat around our organs visceral fat. High levels of visceral fat and fatty liver are markers for underlying metabolic disease. Things like diabetes, hypertension, hyperlipidemia. The underlying process with insulin is affecting our metabolism overall. One of the things that having the elevated estrogen levels does is that it affects how our liver functions. High levels of estrogen and testosterone disrupts the certain functions in the liver. So for example, even the production of cholesterol, right? Cholesterol. And we know that cholesterol is important, the molecule that allows the transport of fat around the body. Women with PCOS have a switch because of the effect of these hormones. We tend to use terms like good and bad cholesterol, but it's more complex than that. We call high HDL the good cholesterol and LDL the bad cholesterol. It's a little more complex, but just for the purposes here, I want to make it easier for you to understand. Perhaps the reason we call HDL good cholesterol is because it's very useful for moving fat and moving lipids All right. So lipids is a broad term for different types of fat-related molecules from our body's tissues. For example, our blood vessels, our muscles. It moves the lipids from our body's tissues to the liver so it can be metabolized and excreted. Now, low density lipoprotein or LDL does the opposite. So it actually moves fat from the liver to our peripheries. And when you have high levels of LDL, you can imagine now that you're going to have higher rates of fat being deposited in our bodies. So you're going to have higher rates of not just fatty liver, which we mentioned before, not just visceral fat, but you're going to have higher rates of fat being produced in our blood vessels, what we call atherosclerosis, right? So, we have, so, and this excess fat deposition needs to narrowing of our arteries, okay? Atherosclerosis leading to narrowing of arteries. And this narrowing gives rise to heart disease, especially ischemic heart disease, where there's decreased blood flow to the heart muscles, which is what puts us at women at risk of myocardial infarctions or heart attacks. It decreases blood flow to the peripheries, so you can lead to disease elsewhere. So the brain, we call that cerebrovascular disease. Using some short-term cerebrovascular disease, just using some shorthand here to speed things up. Renal disease or kidney disease. It can affect in severe cases, even blood flow to our legs and feet, what we call peripheral arterial disease. All right, we call PAD for short, peripheral arterial disease. So you can see that a whole host of vascular complications can arise. All of this is arising downstream because of the metabolic effects of what we call polycystic ovary syndrome. We're realizing now that this is a far more complex issue than just being a menstrual problem. Let's clear some of this up. I want us to talk a little bit and even about the fact that the women with PCOS do have even psychological impacts. We mentioned that there are higher rates, affects even the brain, higher rates of anxiety and depression. We don't fully understand why, but we understand that the brain is affected by hormones. If it is that the hormonal balance is disrupted, then it's quite likely that there are going to be also psychological effects because of the effects on the brain. That's one reason, right? So one theory is the hormonal effect. The other is perhaps the fact that there are other issues that contributes to a woman's self-image. So of course, if there is infertility, we know the psychological impact that it can have for a woman who is trying to get pregnant and is unable to get pregnant. All right, so we have infertility being a contributing factor. We have menstrual issues and just overall poor health and the psychological impact of that. All right. We have also obesity, issues with self-image. So you realize when we combine all of these complex issues that are arising due to PCOS, it's not surprising that women with PCOS have higher rates of depression. The evidence does show that women with PCOS are 10 times more likely to attempt suicide. And that's the reason why it's so important for us to talk about this and share this information. And that's the reason why I don't mind taking the time to teach on this, because I believe that it's worth doing. If we can do this, we can help many, many women out there. Okay. We've seen that the whole issue of PCOS is quite diverse and affects all the different systems of the body. We have seen that because of polycystic ovary syndrome, women are at increased risk of diabetes, hypertension, hyperlipidemia, fatty liver, obesity, heart disease, stroke, kidney disease, liver disease, peripheral arterial disease. We have seen that the hormonal changes, high testosterone, high estrogen levels, high insulin levels, has its impact. The hormonal impacts including irregular periods, infertility, depression, abnormal hair growth, cancer, acne. So hopefully that was beneficial to you. And as I said before, let's make sure that if this is something that you are passionate about in terms of helping women to live happier, healthier lives, then make sure that you're sharing. If you're new to the channel, be sure to smash the like button. Be sure to subscribe, and let's continue to help women live happier, healthier, more fulfilling lives. I'm Dr. C, the Women's Health Doc, and I'm signing off until next time. All the best until then.